Hello, good morning, good afternoon, good evening. A warm welcome to Meet Menaca to celebrate you. Today, we are having our episode 63, Gut Health, with Dr. R. Mathialagan. He's a consultant physician and gastroenterologist. Before we start the show, I just want to tell a little bit about the talk show. It's called Meet Menaca. It features health experts and real people sharing real stories. And it is a 90-minute multicultural online talk show to celebrate individually you. We can join the event or the show by registering the link or in the Zoom or by Facebook Lives. And later on, we do share it on the YouTube. So please support our channel to add value, to share inspirational messages, messages from health experts, and create a positive change by subscribing, by hitting the bell icon, and to be notified as well, because many of you send me messages on Facebook and text, when is the next videos are coming. So please try to subscribe and you will be notified on its own. A very warm welcome to Dr. Mathialagan. It's a pleasure and honor to host you. Thank you, Dr. Mathi.
Thank you, Menaca. Thank you for your invitation, and I'm delighted to see many people already in the audience.
Thank you. So there's an old saying which says, we dig our graves with our teeth. What we chew into our body, that determines our gut health. It's very important to pay attention to that. So what is gut health? Hippocrates, the father of Western medicine, once noted that all diseases begins in the gut. Including myself, in the business of our everyday life, we have kind of lost sight of this ancient wisdom. Many would say it's the reason for millions of cases of chronic diseases. So if you are struggling or you know someone who is struggling with bloating, constipation, or the digestive issues, or any gastrointestinal disorders in particular, I think you must pay attention to today's speaker, who is Dr. R. Mathialagan, to learn more, and you will be able to ask questions. So let me tell a bit about the speaker today. Dr. Mathialagan is a passionate educator and a teacher. He's a consultant physician and gastroenterologist at the Queen Elizabeth Hospital at Kings Lane. He grew up in Sudumalai, a village in the northern Jaffna district of Sri Lanka. After studying at the world-renowned Manipal Hindu College, he discovered his life's purpose in medicine. He went on to graduate from the Jaffna Medical Faculty, where he is the founding president of their medical faculty overseas alumni in the UK. Dr. Mathialagan moved to England to complete his postgraduate studies and became a research fellow at the Royal Postgraduate Medical School in London. He did his postgraduate training in gastroenterology in Oxford. Constantly aware of the need for the excellent doctors and giving back to the community, he grew up in Dr. Mathialagan actively involved in helping and supporting medical education in Sri Lanka. He is very well renowned, and I'm sure he has many decades of experience behind him. So as I mentioned before, it is our honor to have him as a guest speaker on this platform. Today, Dr. Mathi, before we delve deep into the subject, to enlighten the audience and ourselves included, can I ask you, what is gut health to begin with?
Menaca, first of all, thank you for this invitation, and also thank you very much for those very generous, kind words. Very much appreciated. I'm not sure whether other people will agree that Manipal Hindu College is a well-renowned school, but I'm happy if you say so. But thank you, I appreciate it. Yeah. So gut health refers to a physical state and the physiological function of the gastrointestinal system. The gastrointestinal system is simply the largest organ in our body. We have 6 meters of small bowel, convoluted small bowel in the abdomen. We have got about 80 to 90 centimeters of large bowel. And this is home to 100 trillions of bacteria, 500 trillions of virus, phages, fungi, and protists. And it also the main driver of the immune system of our body. and is also, as we know, that important for digestion as well. And we know it is closely linked to many inflammatory, metabolic, functional GI disorders, and is also a lot of other extra gastrointestinal disorders like neurological conditions also being linked to this gut health. And it is an important part of what we know.
Sure. Thank you so much. Recently, there's a lot of discussions about gut health in media, expert discussions alike, and articles recently. Why do you think it has attracted the massive amount of attention it has?
Yeah, I think that's a very good point, Menaca, because probably one of the most significant medical discoveries of late is the huge role the gut plays in disease and in health. The 3 pounds of microbes we carry around us is more important than a single gene that we have in our genome. And, as you rightly mentioned, that when the father of modern medicine, Hippocrates, said that all diseases begins in the gut, modern medicine is now only beginning to catch up with this early, very popular prediction. But we know that the gut bacteria, the bacterial flora, the we call a microbiome, plays an important part in both physical and mental health. And we can go on to that in our next discussion.
Sure. Thank you so much. At one time, as you rightly said, our digestive system was considered relatively simple. It's just a one long tube, or for the food to pass through or be absorbed and then excreted. But recently we know that it's much more complex and much more important than in that simplicity. And these days there are so many options. Everyone seems to be an expert, and each formula or product or service seems to claim it is the miracle answer. As an experienced clinician, what is your take on this? And I know, there is, at least in my limited knowledge, I know 300 to 500, microbiomes are there. So what is its relevance to physical and mental health as well?
I think you're right, Menaca. There's so much written about this. There are a lot of social posts, WhatsApp messages, Facebook posts, and everything come up. I think pseudoscience, the fake news, conspirational theories are all diseases in themselves. But it's interesting, Avaya said that what we know is just a drop, but we don't know is an ocean. In Tamil, kattadu kayyalavu, kalladadu ulagalavu. And it's also said that, when we are in medicine, medical science is advancing very quickly. And what we know now, that is being proven well beyond any doubt, what we know now in 5 years' time may not be correct or may not be truly what we believe. For example, we talked about in the past for hormone replacement treatment for postmenopausal women, but we know that that is something that we need to be very careful when we recommend it. And also, for example, the other intervention that we thought in the past was useful for a stable heart disease, people said that they go on to do a primary angioplasty to open up the arteries. And now we know for stable heart disease, the medical treatment is as good and as effective as. So I think there's so much been written about. I think it is important to keep an open mind about it. And my take on this is personalized nutrition is the way forward. I don't think there is any single diet would work for every one of us. We're all different in the way that we react to things, in the way that we metabolize things, in the way we have got certain likes and dislikes in our food items. So the personalized nutrition is the way forward. And also, in my mind, that the healthy gut rests on 3 fundamental pillars, which is the healthy gut flora, and also a good balanced diet, and also regular exercise. So yeah, that is what I come down to. I think it is important to be aware that what we read, what we hear, what we see is not always true, and it's not applicable to all of us one single thing. So we need to work out, and sometimes it's a trial and error when it comes to dietary tolerance and the side effects.
Sure. Thank you, Dr. Mali. That brings me to the next question very nicely, because a lot of media attention is there on gluten-free diet, and a lot of celebrities are advocating it. What is your opinion on that as a specialist in this area?
I think that's a very good point that you highlighted. Celiac disease, it is a gluten sensitive to certain people, is very common among Caucasians, in the Western part. 1 in 200 people carry this gene, and it's very often it is under-recognized or underdiagnosed because people are not being aware of it. And it's been studies have shown that 10% of the people who we think may have an irritable bowel syndrome turned out to be having celiac disease. So it's so common, and it's a simple blood test which has got a very high specificity and sensitivity of 95%. It can be done, and it is a good test to have it done. But I have to say, it is less common in people of Asian or Indian subcontinent people. There are cases, but when I practiced in Sri Lanka, I haven't come across any patient. But in my practice here in the UK, there are a few people I have come across in people from Indian subcontinent of Asian origin. What is interesting is that in celiac disease, the gluten is a type of protein which is found in certain diet, for example, barley and rye and wheat, and which is a very complex protein. It is difficult to digest, and that itself can lead to some abdominal bloating, abdominal pain, and excessive flatulence. So some people, as I mentioned, in the Western population, 1 in 200 people carry the gene and they have got celiac disease. But I'm not sure about how common in our population. I'm not aware of any particular studies, but what is so common, I find, among both Asians as well as people who, Caucasians, is that what we describe as a non-celiac gluten intolerance, which means that you don't have the celiac disease. The celiac disease, by definition, means it destroys the small intestinal villi, which is important for absorption of nutrients and protein and everything else. So that destroys the villi so that you will not be able to absorb nutrients and vitamins. You become anemic, you become very unwell due to some malabsorption of those important macro and micronutrients. But people with gluten intolerance, they don't have that damage to the intestinal villi, but they do react badly to a gluten-containing diet. And that is why, as you mentioned, that a lot of people are on gluten-free diet. They haven't got celiac disease, but they do react quite significantly to the gluten-containing food. So that's what I think I see in my practice. People come with that they have got celiac disease. We do the test, and when the test is negative, we do advise on them to see whether they can cut down on those particular food to see whether their symptoms get better.
Sure. Thank you, Dr. Mali. So, that is one diet we are talking about. There are a lot of different diets available in the market now. For example, high fiber diet, protein diet, Atkins diet, some for weight management, others are for various other reasons, perhaps. What is your take on this as an expert?
I think you're right. There's a lot of information out there. Everyone, as you say, seems to be expert coming out with books and videos, how to lose weight. But I coming back to the point, the important thing is to have a good, healthy, balanced diet. In the recently reported study on Lancet, the WHO's study, what showed is if people stop smoking and if they're able to reduce their alcohol intake, and if they have a healthy, balanced diet, and if they also have a regular exercise, and I think we can cut down lots of symptoms and the ill health. But coming back to the particular diet itself, I think everyone is different. The personalized nutritional support is the way forward. As long as we maintain a good balance of macronutrients, for example, the protein, carbohydrate, and fat. The Atkinson diet you mentioned that heavily rely on very high protein diet. So I don't think our body is designed to deal with that level of high protein intake over a period of long term. It's okay for a short term. I know that people lose weight on those, but it's important that you should be able to maintain and sustain that weight loss. So I think it is always helpful to modify the diet in a way that you can maintain for a longer period of time. So an advice from a dietitian is helpful, and having some ideas about what your likes and dislikes, provided that we maintain. I think it's coming back to the diversity. We talk about the diversity is a very important part of any institution or any organization. Diversity of people, diversity of thoughts, diversity of ideas, diversity of opinions. So it is important for a healthy balance. Similarly, I think the diversity of the gut flora is very important. So the fruits, the vegetables, meat and fish and legumes and seeds and nuts, everything, that when you increase the diversity of the gut flora, and that also can contribute to the healthy life being. So I know it is a lot to take, but the point I was trying to make is no single diet seems to work with everyone. We need to be very careful. A good balanced diet contains a good combination of macronutrients and micronutrients, and that should be a long-term and sustainable goal. There's no point that you go on a crash diet and lose weight, and after some time that when you get back to normal and then everything that you would not be able to implement it. So it's difficult, but I think what you need is motivation, you need to have patience, and you need to have discipline. I think if you have all three, I think you can succeed. And that's what our parents used to say. I think they were right. You have a discipline, if you have motivation, and if you have patience, you can certainly overcome in anything that you encounter in your life.
Sure. Thank you so much. I mean, many people have been on diets, including myself. So I know the pain of it. And yes, it is, maintaining that motivation is hard, but, I'm sure it's achievable when you put your mind to it. Thank you, Dr. Mali. We have spoken so much about what is important, and I will definitely remember about the diversity. Rightly so, there's so much attention has come on, diversity and inclusion in organization and businesses. And I think that is, you couldn't have explained that in any easier way for people to remember it. It is the same with the microbiome in the gut. Recently, we have been also hearing how it's important for your mental health. It can disturb your sleep and it can cause different issues. So as a consultant gastroenterologist for a long time, what are the common disorders of gastrointestinal system? And, I have friends from having acid reflux to different things, and even Crohn's disease in my family or extended family. So what are the common disorders and what are your thoughts about it?
Yeah, I think, I'll come back to that, Menaca. Thank you. First to say is that all these microbiome in our gut, they produce cytokines, neurotransmitters, and they've got chemicals, and they've got a lot of other thousands different variety of those things. And some of them are happy hormones we know, like serotonin and dopamine. And 95% of the serotonin receptors are in our GI tract. So it plays a very important part. And it promotes a positive feeling. When you have a good bacterial flora, it helps with the digestion. It also helps with the appetite, so you are able to eat the amount that you need. It improves your mental health in terms of releasing those happy hormones. You become less anxious, and you generally feel that you are able to function very well. So I think it's very important. The diet, coming back to the point that if we have a healthy, balanced diet, I think is always helpful. We also have a tendency to overindulge ourselves, and that lead to a number of problems. Maybe we can come back to that at a point when we discuss the next one. So coming back to your question about the common gastrointestinal disorders, what I see in my practice is what we call a functional GI disorders, irritable bowel syndrome, gastroesophageal reflux disease, and also some motility problem and non-cardiac chest pain. What I mean is that people can come with chest pain. That is a very important symptom where people are worried whether it could be related to heart disease. But we know that the esophageal pain the reflux pain also can mimic heart disease as well. So those three, non-cardiac chest pain, gastroesophageal reflux disease, and irritable bowel syndrome, are probably the main functional bowel disorder I see in my practice. It is so common, 1/3 of the people do suffer from it. And it is also possible, it is so common, so combination of those diseases can coexist in one particular person. So these diseases, the important thing is that certain disease that you treat, for example, you have a chest infection, you give antibiotics, you get better, and you are back to your normal health. But unfortunately, these functional GI disorders is that they are recurrent, they are chronic, they have relapses and remission, but they are benign. They're not serious problem. In majority of the people, we all suffer from at some stage that when you overindulge, you will have some symptoms relating to the pain and bloating and reflux disease. But by nature, they come and go, the remission and relapses, they have a benign course. So you have to be aware that you might get relapses that will require some form of treatment. So it is important to see how you can modify those symptoms by adjusting your diet. And if necessary, you can take medication on demand rather than taking them on regularly. Because again, we have to be careful, over-medicating people can lead to lots of issues. Sure. So, very often said that we tend to overstate the benefit of treatment and we downplay the side effect of the drug. So if you can manage by modifying your diet and lifestyle, those symptoms will get better. I'm not going into specific detail, but I'm just giving an idea what drives this process. But certainly for irritable bowel syndrome, people come with bloating, people have abdominal pain, people have got excessive flatulence, people also can have change in bowel habits. And those things can certainly, by modifying the diet, people get better. In fact, some studies showed when people don't have a FODMAP diet, which is diet which has been talked about, people do get benefit from it, because what we are trying to do is trying to change the bacterial flora, so which is more friendly. Like in our gut, there are friendly bacteria and some are not so friendly. So what the plan is to try and colonize the bowel with the friendly bacteria. That is why people talk about the prebiotics and probiotics and their role in those diseases. So those are the three common disorders I see. And very often I find when you take time to explain to patients what they need is reassurance. I think it is important. I think 85% of medicine is about reassurance when it comes to the type of functional GI bowel disorders. And about 15% is perhaps modifying the lifestyle, and then perhaps only few percentage of people will require some medication depending on how their severe symptoms are. So those are the three things I would say, but I know that we are going to talk about ulcer disease at a later point.
Sure. Yes. So I was about to ask, can you share about gastroduodenal ulcer and its management, but particularly on that note, in your experience, historically, how the management of this duodenal ulcer has evolved with time? Because like everything else in medicine, I guess, that is a major. So I would love to hear from you as a specialist in the area.
Meena, thank you. I think it's something that close to my heart, because that is the area that I researched when I was a research fellow in Hammersmith Hospital. The person who described Helicobacter pylori, which is a type of bacteria which has been there millions of years in our gastrointestinal tract in the stomach, but it has not been identified. It was identified in 1984. The story how it came about is also very interesting. Maybe I would tell before I forget, before I come back to the historical perspective of the ulcer disease. So as I mentioned this in the past, over the years, when we were medical students, 80s and people before that, 60s and 70s, people had this ulcer disease, and majority of them had to have sometimes surgery to remove the part of the stomach, or have to remove some of the nerves that is responsible for increasing the acid secretion. So we didn't have any effective medication to heal the ulcers in those days. And as a result, people with the significant acid problem leading to narrowing and the stenosis of the gullet, and sometimes the ulcers and the strictures of the stomach as well, leading to surgery and having to dilate those. But thanks to the medical intervention, I would say one of the very important discoveries is some of the very effective drugs we have now is the PPI, proton pump inhibitors. Since it was introduced in late 80s, and since then, we have not seen those major complications, people requiring removal of the part of the stomach, or the strictures are a lot less common. So much so, the current generation of surgeons don't even know how to do what we call a highly selective vagotomy to remove the nerve. So those no longer necessary. But coming back to the bacterial story is very interesting, because when we were students growing up in Jaffna, when I was practicing in Kandy and in Colombo, there are a couple of people who I worked with. At that stage, it wasn't particularly well described. People thought giving some antibiotics worked in some ulcer disease people. We used to give metronidazole, they got better. People also in the past used to give milk drip, which I wouldn't advocate, but it was something that people used to give. But in 1984, this discovery of Helicobacter pylori, which is a microaerophilic bacteria, was identified by two Australians worked in Western Australia. And so much so, this discovery, they were awarded Nobel Prize in early 90s for this discovery. And what they did was, why we couldn't identify this bacteria, though it was been there for a long time, was this particular bacteria needs about 3 to 4 days to grow on the agar plate. Normally, what we do in majority of the bacteria can grow on 48 hours. And if you don't see any growth, and people will look at the agar plate and they'll throw it. But this particular year in 1983, in Western Australia, the Easter holiday lasted more than 4 days. So they plated this agar plate before they went on Easter break. And when they came back from Friday, the next Tuesday, they found that there were organisms growing up in the agar plate. So they realized, and so then they went on to do more trial. In fact, one of the Nobel laureate, and he actually swallowed this bacteria and demonstrated ulcer to make sure that was the real cause of the ulcer problem. So now we have got this duodenal ulcer. About 90% of the time, the duodenal ulcer is due to this Helicobacter pylori. In Indian subcontinent, majority of us by the age of 20, about 90% of us will have this bacteria in our body. But not all of us will develop ulcer disease. Why we don't know why only certain percentage, only about 5 to 10% of people will develop ulcer disease. We don't know why. It could be due to the individual makeup. Also, it could be due to the antigenicity of that particular bacteria. But once you have identified, there are a lot of ways that you can check. Now we can do a stool sample to test for the antigen for that Helicobacter. And if you eradicate it, majority of the time, the symptoms get better and it doesn't recur. But in some people, it can come back because it is a disease that can spread across close contact in family members as well. So that's a story about. So the Australian will say, people say it was an accidental discovery, but the Australian would say, the nature also helps the prepared mind. So it happened to be that, the Easter holiday break was the one which led to this discovery.
Sure. Thank you so much. I thought penicillin was found something very similar story. Yes. I guess it is how they take it on board and then do the rest is what makes the difference, I guess. Thank you so much. There's another topic which is really important is alcohol and liver disorders. The connection is well known and well established. However, when it comes to liver cirrhosis or fatty liver, which is it's commonly known, is believed to be related to alcoholism. Recently, as an expert, you would know much better that amongst the experts and specialists, they say it doesn't have to be so. So what is your take on it?
Well, again, a very important topic. Thank you for bringing up, because it is something that I believe there's a lot of misconception and misunderstanding about this liver disease and fatty liver. You're right, alcohol is still the leading cause of liver cirrhosis in all communities, and in UK, and also the alcohol intake amongst Sri Lankans or Indian subcontinent people remains still very high. And that is very, something that we as a society have an important role to make sure that people are aware of the alcohol, the damage it can cause. But coming back to the point that there are a group of people that we now see, they haven't got any increased intake of alcohol. In fact, some of them don't drink at all, but they do develop a type of liver disease, scarring, fibrosis, and cirrhosis. But that is one of the leading, in fact, this is one of the 3 common causes of liver cirrhosis in the Western world. So what happens is, when people take more calories and nutrition than you need, and you will get some fatty deposition in the liver, and also in other areas as well, in the subcutaneous tissue, and also sometimes around the pancreas, the sweet gland. So when those fatty deposition in susceptible individuals, it can cause some reaction, release of some chemicals and cytokines, and that lead to scarring, fibrosis, and cirrhosis in the liver. So this is common because we know that 1 in 3 of us carry too much weight, and the obesity is in a real pandemic. As a result, we are seeing so many of those patients having this fatty liver. Not all of them carry too much weight. There are people who are lean, still they have got fat in the liver as well. So we need to be aware of that. The important thing is that the interesting theory, which again been proven by one of the UK leading diabetologist, Professor Taylor, and his theory was that when you take more nutrition and calories more than that you need, those calories are deposited, the fats are deposited outside the liver in the tissue, and also in the pancreas, in the sweet gland, which is important for the diabetic insulin. So in susceptible individuals, those fat deposition in and around the beta cells which producing the insulin cause a reaction, and you become what they call insulin resistant. So insulin level goes up, but you're not able to make use of the insulin function optimally. And that leads to diabetes, and that tend to then increase the further problem in terms of fatty liver and scarring and cirrhosis. So the important thing, again, coming back to the point, is to the diet is important, the exercise is important, because this condition is reversible if you catch it early. If you reverse the process of that, reducing your calorie intake, reducing your weight, and increase your diet and also exercise, you can reverse the fatty liver. But you have to be very careful. If you're over the age of 45, we have got diabetes, and if you have got other risk factors like heart disease, and your risk of developing liver scarring and fibrosis is supposed to be higher than the other people without those risk factors. So it's an important topic, as people can make sure that they can reverse the process. And it's also interesting that we know that, the alcohol, the amount of alcohol in the UK, you can drink 14 units safely, supposed to be in moderation, is good. But in people who have got other risk factors, who have got fatty liver, who have got diabetes, even that level amount of alcohol can be harmful. So I think the safe limit is again variable depending on your other risk factors. And we also talk about the gut bacterial flora that also played an important part in the fatty liver as well. So it's all coming down to, that's what you mentioned, there's so many things been written about this gut microbiome, how it can help in preventing all those diseases that we've been talking about.
Sure. Thank you so much. I think because it's really, really important, because there's a common knowledge or common belief that if you don't drink alcohol, then you're never going to have liver cirrhosis. So I think that's why it's really important to.
Can you just mention, madam, just before when you mentioned that just occurred to me, if that's okay.
Yeah, of course.
Yeah. So when in 60s and 70s, we know a group of people who developed liver cirrhosis. We label them as cryptogenic or idiopathic liver cirrhosis, which means that we have done all the usual tests. They're not taking alcohol. They don't have the viral hepatitis. They don't have any other drugs that can cause liver cirrhosis. But we label them as cryptogenic or idiopathic liver cirrhosis. But we know now, since the introduction of this non-alcoholic steatohepatitis and cirrhosis, 95% of those people we thought we didn't know the cause is that now is due to NASH or hepatitis C. So that shows that, that's what I mentioned about having an open mind. There are things the medical science may not tell us what is happening, but in future, we would be able to relate to that particular problem when you have more diagnostic tests become available and when the awareness increases. So, yeah, so I just wanted to make you aware that I remember seeing patients with labeled as cryptogenic. Generally, they tend to be middle-aged, slightly increased body mass index female. I'm talking about back in Sri Lanka, but we don't use the term cryptogenic liver cirrhosis anymore, because as I mentioned, 99% of the time we know the cause for liver cirrhosis now.
Thank you so much for that. Moving on to esophageal cancer, unfortunately, like all other cancers, I guess, gastrointestinal cancer is also becoming more common, or more diagnosis there. I don't know which one is true, but can you elaborate on this, please? Because it's becoming a bit more common even amongst Southeast Asians or other people.
Yeah, no, that's very true, man. I think if you look at the UK, the incidence of esophageal cancer has increased about 30 times. That is from the single most cancer has gone significantly in the UK. We know the bowel cancer is probably third or fourth common cause of cancer in the UK. And then we also have in other gastrointestinal cancers like liver cancer, which cirrhosis is another risk factor for liver cancer. So coming back to the esophageal cancer, the risk factors we know are what we call a gastroesophageal reflux disease. There is a condition called Barrett's esophagus, which is due to the acid reflux. You get slight change in the lining where the gullet meet the stomach, the gastroesophageal junction. And that tends to cause some reaction due to acid reflux. And that then we believe predisposed to increased risk of esophageal cancer. As a result, people advocate that if you have got that condition, what we call a Barrett's esophagus, people advocate that you have a screening test every few years or so. But that's again, something that we have to be careful when it comes to the screening test, because that's again one of those very, I would say, inappropriately used a tool to try and identify a problem. So the other risk factors for esophageal cancer is smoking, alcohol, increased weight or BMI, increased people who are overweight. So those are the other important factors, smoking, alcohol, and obesity, in addition to the gastroesophageal. So these all can be addictive in the sense, one of the things can promote this reflux. For example, people with alcohol and obesity can have a more incidence of reflux disease. So it's all about try and control it. And so what we do know with the Barrett's esophagus is we feel that giving some medication to reduce the acid reflux will help. And then we do have a regular surveillance, which again, depending on the individual, that can vary. But it's very common. The Barrett's esophagus, one of the problems we have is 1 in 20 people in the community has got Barrett's esophagus. Whereas in Sri Lanka, and I know about Sri Lankan studies, but I don't know about the other Asian studies. But in Sri Lanka, the incidence of esophageal cancer is a different type. which happens in the middle of the esophagus, so upper third of the esophagus, whereas here we see more often in the lower part of the esophagus. The histological type, one we call a squamous cell cancer, the one is an adenosine cancer. But again, it coming down to smoking and betel chewing is the other risk factor that people perhaps in the Indian subcontinent carry a risk as well. People talked about some thermal injuries where when people used to drink very hot tea, or that perhaps in some of the Iran studies showed when you have a thermal injury can lead to esophageal cancer. Again, it's not very well proven in other studies. So combination of things, smoking, alcohol, increased BMI are the main drivers. So coming back to, as I mentioned, the lifestyle modification plays an important part. That for the esophageal cancer, it is a very aggressive cancer when it happens, very unpleasant cancer too, because you're not being able to swallow, you're not being able to swallow your own saliva. So it's something which, as a gastroenterologist, we find it is a very difficult cancer to deal with when it comes to relieving patient symptoms. The other cancer we talked about, bowel cancer, and the recommendation is that we need to have a good amount of dietary fiber in our diet. It's about, they say the recommended 30 grams of fiber, which contains in good vegetables and fruits and the brown bread and everything else. But it's also important when I mention about fiber, you don't have to overdo the fiber. If you overdo it, also you can create problem in terms of bowel symptoms. People can develop bloating and the pain and discomfort. So it's about, but in average, they say in the UK that we have about, instead of 30 grams, we have about 10 or 15 grams is the average fiber intake in the UK population. That is why the bowel cancer, one of the reasons that there's a bowel cancer is high in the UK society is because of that. So the recommendation is increase the fiber intake to 30 grams, and that will improve your diabetic status, reduce the type 1 or type 2 diabetes. It improves your weight, it reduces the bowel cancer. It also has important effect on the breast cancer as well, and the stroke. So overall, all coming down to say what suits you. I think that's the important thing. It is a personalized nutrition is important. One, we all different. I think having a dietitian and also have a trial and error to see what you find is become difficult or intolerance, and then adjust those medications, provided that you maintain a diversity of good the dietary requirements in terms of fruits and vegetables, and in terms of nuts and legumes and the meat and the fish.
Thank you. That's a very comprehensive answer. So thank you so much for that. So coming on to the next one, we have read or heard about overdiagnosis, treatment, and people being on a concoction of medication in the recent years. This itself is becoming almost like a pandemic on its own. So as a clinician in secondary care, what is your view about this topic?
Yeah, I think that's, again, Menaca, and I'm quite enjoying this talk because it's one of those areas which is very close to my heart because, I've been, practicing clinicians for the past 35 years. So I have seen over the past 2 decades how the medicine has changed. So as you rightly said, the overdiagnosis, overtreatment, over-medicalization, over-intervention is really a pandemic proportion. As I also mentioned initially, that the benefits of treatment are overstated and the side effects are it is undermined, or perhaps people don't talk about the side effect. There is a tendency for people to, prescribe medication. It is easy to prescribe medication rather than stopping a medication because that is how the people's psychology works. So what we have to be careful is that when it comes to overdiagnosis, there are a few things that drives that process. One is the fear of litigation, because defensive medicine has become an important part of clinicians' mind. Missing something, so we tend to do the test, and that result in some harmless abnormalities, and that increase the anxiety in the patients, and then you end up doing more and more tests. And then obviously the other drivers for the overdiagnosis is a fear of missing a diagnosis. So that is why people tend to do most tests. And that also, as I mentioned, you come across some harmless abnormalities and people don't know the significance of it. And the third factor I would say for overdiagnosis, the lack of skills in identifying uncertainties. For example, medicine is not real science. It is a science, it's an art, but bit of a science. So I think the important thing to be aware is how you deal with uncertainty. Uncertainty that will come with experience and have an open mind about, rather than that having a label for the diagnosis. And also, in a lack of perhaps knowledge, the harm too much medicine can cause. The recent studies in fact reported a couple of weeks ago in the British Medical Journal, the chief pharmacist in the NHS said 1 in 10 prescriptions we are giving now is inappropriate, and about 20% of the admissions over the age of 65 to UK hospitals are related what we call iatrogenic, which is caused by us. So, for example, if someone comes with a headache or nausea or vomiting, abdominal pain or constipation or postural hypotension or drowsiness or falls, all those things, the main reasons where we have elderly patients coming to hospitals could be related to the medication they get. So it is pandemic, it is a real problem. I think it's important that there is now a recognition across the world that we need to bring back the humanity back into how we can try and have a healthy balance in attitude. I know people become anxious, people do worry about it, but the important thing to say is that, in my opinion, I think the best doctors are not those who are supposed to be bright or well informed. I think that if you have the ability to deal with the uncertainty and how you make judgment, I think that is important. Otherwise, that we will create more panic and more anxiety among patients and colleagues.
Thank you so much. I think I couldn't agree more. I have asthma and certain other migraines or whatever. I have been many medications, and I think its holistic approach is becoming more and more popular, and I rightly so. And like you said, it is not about giving a prescription. It is seeing a person for who they are and trying to personalize medicine is also kind of lost, isn't it? So, it's, I think it is not everything is for everyone. And I think that's a good place to start, I guess.
Yeah.
We are almost coming to the end of the show, almost. So I just want to ask a couple of things from you. Are there any recent medical advancements in the field of gastroenterology? Because I know medical world, like you rightly said, it keeps evolving by the second. So what are the latest advancement in your field?
Yeah, I think, as I mentioned, Menaca, certainly the things that has revolutionized or changed our medical practice is on the Helicobacter pylori, which we talked about 35 years ago. I know that you mentioned about recent, but I'm just telling how it has evolved. And the recovery and the, finding a proton pump inhibitor, very effective acid treatment was also, anti-acid treatment also was, I would say, an important discovery. But over the years now, we have got on diagnosis that we have got very good techniques now in terms of non-invasive. Those days we used to do a lot of barium studies, the barium enema, barium follow. We don't do it now because we can do an MRI scan. We can do a very straightforward, fairly comfortable procedure to look at your large bowel or the top part of the bowel. We have got what we call a capsule endoscopy, where you can swallow a pill which has a camera which can take pictures as it goes down to the lining of the bowel, and then we can look at those pictures. So in terms of diagnosis, there are a lot of things have advanced. And in terms of treatment for GI disorders, and now inflammatory bowel disease, which you mentioned about Crohn's disease, ulcerative colitis, and we have a very good new drugs which keep coming, the biologicals and immunotherapy, those are also have a very important part to play. It's interesting, in the past, we had very little choice. And it's also true, people used to say the old medicine is simple, ineffective, but safe. But the modern medicine is complex and it is effective but dangerous. So those medications are effective, but we also need to be aware of the possible side effects. We also know that how we metabolize drugs, how we respond to certain drugs are different. And there are ways that we can identify. But in the past, we just empirically treated with everyone. But now we can have, as you said, a personalized medicine for people. So that is, again, an important advancement, I would say. And also now we are able to do some specific tests for bowel cancer screening, fairly good test, what we call a fit test is available in the GP practice. Instead of those days, we used to recommend some screening test. But in the UK now we were able to offer those tests. So yeah, there have been developments in many areas in terms of diagnosis and management, and also the surgical skills every day keep advancing. The anesthetic also advancing, where you can have surgery for 3, 4, 5 hours without any significant problem. So people can operate what we call a keyhole surgery, and again, robotic surgery. So there are so many advancements in every aspect.
Thank you so much. Immunotherapy in particular, I mean, till recently, I wasn't aware of something called immunotherapy, to be honest. When I studied, we definitely didn't study. So only in the recent years, we have come to know terminology called immunotherapy. So, like you rightly said, there's so much of advancement. It's almost, becomes a job on its own for medical profession, I think, to keep up with the medical advancement.
Correct.
As a last question, before we finish on the Facebook Live, I just want to ask, what are your 5 must-remember take-home messages for our audience, for themselves, or to share with their friends and family? What would they be?
Right, okay, thank you. I think first is very basic lifestyle advice. Stop smoking, drink less alcohol, regular exercise. A good, healthy, balanced diet will keep you a long, healthy, very, a very happy life. So smoking, alcohol, diet, and exercise. And that is an important part I think we need to have in mind. The other one is coming back to the overdiagnosis. And if you go and see a doctor or you are having some medical advice, I think it is important these days to ask what exactly the test involved, what the doctor is thinking of, what are the alternatives, what if I don't do anything? So those questions that everyone need to ask, because I think there's a tendency, as I mentioned, that give more pills, and that relating to not necessarily is going to be helpful. So have an open mind when you have a consultation, ask those important questions. What is this test for? What you are trying to do? What are the alternatives? What are the side effects? And what will happen if I don't do anything? So that sort of thing, medicine is always carries a small amount of risk, but what we don't want is create a health anxiety and that problem. The other one is we talked about the pseudoscience, the fake news, and the conspirational theories, a very important part to make sure that you keep an open mind. Don't just believe or believe whatever you hear or hear from the message or on TV or papers. And, you can take it on board. But again, it's important that we all different in the way that we respond to different medication. And we talked about the diversity of thoughts. As I mentioned, that I like the idea of the diversity of the gut flora that only can come by eating different foods. And that's important. Finally, I just want to also quote a Tirukkural, which everyone knows about. Thiruvalluvar, one of the well-known Tamil laureate and a scholar. And he mentioned when it comes to particular food, he said, "Marundana vendavam jaakekki arundiyadu attadu pottiyunin." in English, it says, no medicine is necessary for him or her who eats after assuring that what he has eaten has been digested completely. So I think it's a very simple advice. It's been written 30,000 years ago, even before I think Hippocrates said about, all the disease begins in the gut. So yes, so simple basic stuff, lifestyle that will help. I know it is not easy. It's easy for me to say, but you need to, if you want to have a healthy, balanced life, and that is where we need to start. And I will stop there, Menaca. That's.
Thank you so much. It is similar to the saying in London, isn't it? If you don't eat food like medicines, you will start to eat medicines like food. I guess it's the same token. So, all we can say is they have been much wiser 30 years ago than we are trying to reinvent the wheel. Thank you so much. I have learned personally a lot. I'm sure the audience has learned a lot as well. Following tradition, I am going to announce the next episode. Episode 64 would be the next episode. That would be on the 31st of October. We are going to be discussing the role of Ayurveda in well-being by Kathy Komil-Chedda. And I don't think it could have come at a better time than following gut health, to be honest. She completed her education in Ayurveda from Oxford of the East, Pune, where Ayurveda is incorporated in daily living, and quite extensively followed. While pursuing her degree, she also gained in-depth knowledge and practical experience from her teacher and mentor. She continued to gain knowledge under various other Ayurvedic practitioners and gain insights into different forms of practice. Whilst she believes Ayurveda is a way of life to achieve good health following the basic principles, she naturally incorporates everything she advocates in her life, as she firmly believes in practice what you preach. After relocating to the UK, she took her time to study the various aspects of life and understood the impact of culture, food, lifestyle, and climate here for better understanding of challenges faced and how best to incorporate the principles of Ayurveda. So she has also successfully treated various allergies, skin conditions, asthma, autism, infertility, menstrual difficulties, menopausal conditions to various musculoskeletal conditions as well. The beauty of Ayurveda is that it treats a person as a whole rather than just working on a superficial symptoms. So I can't wait to learn how to incorporate Ayurveda into achieve optimum life. I have to add, and I feel compelled to add at this moment, that I suffered from asthma for many, many years. After I never had asthma, my family doesn't have asthma, but after coming to the UK, somehow I landed up having it. And only after going to Kathy, quite a few years back now, 5 years back, I guess, for 2 years, I never even had one symptom of asthma after that. And so I definitely believe in it. I can give the personal attestment for, because I have, been with her and had treatment under her. So coming back to the show, and I can't, tell, I think this is, I would say, it's fair to say, I think this is the first time we have heard a medically qualified, Western medicine qualified doctor coming and saying so much importance of the lifestyle factor in maintaining our health. So thank you so much for that. Over to Kirby Kohut to give the vote of thanks.
Wow, I've lost for words today. I've learned so much. On behalf of Meet Menaca, celebrating you, real life, real stories, and stories that will build our health. We have got great speakers coming to speak on many different topics, such as today, gut health. People who are watching on Facebook, we would like to thank you for your support, and we would really like to encourage you to go on to Meet Menaca YouTube to watch all our previous episodes, to those episodes that you didn't attend or those you have not heard. Please go do some searching, learn, and empower yourself on your health matters. Those who are on the platform today, we like to also thank you. And those who are new today, we welcome you to our Meet Menaca community. The links are placed on the chat. We also would like to welcome you to be part of the Facebook group. And last but not least, we thank you for your support. And for Dr. Madhi, our heartfelt congratulations for educating us and bringing this beautifully spoken and shared subject on gut health, which has shed much light today on, for all of us, I believe unanimously. We would like to thank you taking time to away from your busy schedule to come and share with us. We thank you, Dr. Madhi. One of the things that I personally took away and which I really advocate, but I'm not a medical person. The thing is personalized medicine and preventive medicine, which you advocate, and I love it. I really love it. I would like to say this: the road to health is paved with good intestines. Happy gut, happy life. Happy life is happy mental health. Thank you, Dr. Madhi. Thank you once again.
Thank you.
Thank you, Kirubai, for that. And once again, from bottom of my heart, I can tell you, it has been really very enlightening. And this is a topic I think, very well deserves more attention, because I think it all starts from there and ends there. And if we don't talk about it as often, it's going to be, I think it's a disservice to people. So on that note, I think I'm going to pledge to ask you to come and do a webinar for us following this at some point. What better time to ask you than when so many people are watching, isn't it, Dr. Madhi?
No, I'm happy to do it, Menaca. Yeah, let me know the topics you want me to say. I'm happy to do that. Yeah.
Sure. Thank you so much for that. So next week, we will be having the role of Ayurveda in well-being next coming Sunday on the 31st, same time, same place. For people who are on Zoom, please hold on. We will come back to your questions. I know that you have already started sending me loads of questions. I will get back to you. For people who are listening to us on Facebook, firstly, thank you so much for joining us week after week and supporting us. And like my friend Kirubai said, please support us to spread these messages far and wide. It's a social cause. So please subscribe us, comment, and ask questions if you need to. And please send us an email or message, and we will put those questions to the speakers as and when appropriate. For people on Facebook, it has come to that time of the day to say goodbye. Until we see you next week, same time, same place. Stay safe, be happy, and keep smiling.